UTI in pregnancy or the urinary tract infection in pregnancy. As the name suggests, it is the infection of the urinary tract in the lady in pregnancy. Urinary tract includes the urethra, the bladder and the kidneys. Urinary tract infection affects 2 to 6% of the pregnant ladies and is a very common symptom with which patient presents in the OPD. The common symptoms of UTI are burning micturition, increased frequency of urination, increased urge, and once she has passed urine, she still feels the desire to pass more urine and patient is not able to pass urine. The symptoms can be pain during passing urine and blood while passing urine and fever. What is important is that it is a very common symptom in pregnancy which, if ignored, can cause complications like preterm birth, sepsis, and also infection once the baby is born. What is important is that we screen for UTI in the first trimester of pregnancy, and if a patient comes out clear for the UTI, we do not repeatedly do the test and go for the testing only if the patient presents to us the symptoms as I mentioned earlier. So it is very important for the patients to know what the symptoms are and why they should present to the doctor. What is important is that for diagnosis we send a urine culture of which the report is expected to come within 3 days, and for 3 days if the patient does not visit to a doctor, will not decide on an antibiotic. Whereas if a patient comes to us with such symptoms, we advise her to send a sample there and then, and we start her on an empirical antibiotic which we change after 3 days once the culture report comes. What is important to note that if the UTI is not treated in the very beginning, it will spread to the kidneys and will cause symptoms like persistent flank or back pain and can cause infection to the mother, leading into sepsis, and will also cause infection to the baby once the baby is born.